we need to augment so that we don't need to tap into the unprogrammed funds because Secretary, ang usapan dito sa Senate with the senators is to remove the unprogrammed funds, no? Because ako personally naabuso talaga siya this last 3 years, no? And so the chain of thought of the senators to remove unprogrammed funds. So I just want to ask the PSA if this 2026, because if you remove that, obviously wala nang pwedeng pagkuhaan ng PSA. Nakapasok na ba lahat for 2026?
Yes, Mr. Chair. Yung 2024 case, Mr. Chair, let me just explain it a bit, ano, kasi of course napakalaki. Nung 2024 kasi, we planned that we will do the community-based monitoring system. But we were not given enough fund by DBM. However, when there was a discussion with the Secretary RC, Secretary Rex, and the President and myself, na kailangan talaga ng bagong datos para nga dun sa ating social protection programs, because the before CBMS yung ating data for the social protection program, yung listahan ng 3, this was conducted in 2019, pre-COVID pa po. So we explained that there is a need to do a new data. That was in February of 2024, and then the President instructed that PSA should do the CBMS together with the census, and dun po nang galing yung augmentation ng pondo kasi it's a census and you will require a huge fund. So dun po yung 3.6, pero hindi na po yun mangyayari kasi one time lang po yun.
Yeah, we just want to make sure, that's where I'm coming from, no? Because we're also looking at the agencies who tapped into the unprogrammed funds, just to make sure that in 2026, when we remove it, everything that you need are already covered in the program funds. Nakita kasi namin, maraming hindi lang naman PSA, daming agencies nag-tap, no? From DSWD, from PSA, from, I think also DepTev, if I'm not mistaken, meron ba? Or, I think some agencies meron no? I can't remember all, no? So it became a buffer, which is good kung legitimate yung project. Maganda naman pag legitimate, pero kung let's say flood control, no? Kasi half of the DPWH requested projects in the unprogrammed funds are flood control, no? Half of it, no? So that's why I was asking earlier, pag dadaan ka ng RDC, ang hirap-hirap, pero pag nag-shortcut ka to unprogrammed, kaagad half of it marirelease, no? So that's why we're asking the agencies if they have if everything is already covered with the 2026 net. Okay. I'll jump to PAPCOM, yung sa teenage pregnancies. Saan ba yung PAPCOM? Yes, ma'am. Yes. I support that allocation to track down teenage pregnancies, but I know that this is a problem that has been plaguing the country for many years. Can you give us an update on the status of teenage pregnancies in our country? I know I saw data that it's going down. The age bracket is going down. So, and how do we address teenage pregnancies in our country?
Thank you very much, Mr. Chair. So the Commission on Population and Development, formerly PAPCOM, has actually been tracking the incidence of adolescent or teenage pregnancy in the country. Tama po kayo, Mr. Chair. Yung ating incidence of teenage pregnancy for 15 to 19 years old, the older adolescents, going down po siya. Pero yung below 15, ito po yung tumataas. And the increase was 35%. From 2021 to 2022, and from 22 to 23, the increase was 6.6%. We already have, Mr. Chair, a technical working group to address the rising cases of teenage pregnancy, which the secretariat of which is CPD, but this is under the supervision of the Board of Commissioners of CPD, Mr. Chair, headed by our Secretary of DepDev. So this is a report also to the Social Development Committee Technical Board. We have a comprehensive action plan already, Mr. President, and this comprehensive action plan includes the involvement of local government units because the issue is on the ground. So the work is from national level involving DSWD, DOH, DepDev, DILG. So we have this multi-sectoral agency looking into the issue, but the CPD regional offices are the ones providing technical assistance and alerts, in a way, like early warning systems to the different local government units. So, Mr. Chair, we have identified specific regions that are really top in terms of percentage of incidents, and we have Northern Mindanao as both highest in percentage of incidents as well as top 5 of number of adolescent pregnancy cases. So we have been reporting, Mr. Chair, to the Office of the President as regards the work being done in Northern Mindanao, and the work is really done coordinating with local government units, specifically doing we have been promoting teen centers, adolescent youth-friendly facilities for referrals to provide services and information to adolescent pregnancies. But may I clarify, Mr. Chair, that the percentage of registered births from adolescent mothers is 9.8%. Siguro we can say hindi naman siya masyadong malaki. It's the trend that is worrying us, and yung 15 and below 15 years old, Mr. Chair.
I saw this data from PSA that girls aged 10 to 14 years old rose by 6.6% from 2019 to 2023. No, so ibig sabihin, yung mga mas bata pa, tumataas siya. No, from 2,400 to 3,300. No, but the overall adolescent pregnancy is going down, but the younger cohort is going up. Yeah.
You are right, Mr. President, Mr. Chair.
And so, how is POPCOM addressing this phenomenon? I know it's very difficult, to be honest about it. It's very challenging, but this is one of the mandates of POPCOM. So, how's POPCOM addressing this phenomenon?
So we have the multi-sectoral technical working group, Mr. Chair, to address the rising teenage pregnancy. This is actually based on Executive Order 141 issued in 2018 for us to prioritize this issue. So the comprehensive action plan, Mr. Chair, has different strategies. Among them is reproductive health education in the formal education sector. We also have the interventions with families. So we also work with the SWD. In the 4-piece program, we have a module to discuss family planning and the issue of adolescent pregnancy as well. And at the community level LGU, we have LGUs that have set up community teen centers where these are also those national agencies, regional agencies, but we really are into our devolution transition where we go down to the LGUs to work with them, the population officers and the health officers to address this.
The biggest catchment area will be DepEd because they're all going to our schools.
Yes, Mr.
And recently, I read in the news that DepEd retooled their reproductive health, retooled their approach to addressing teenage pregnancies by implementing reproductive health education
Yes.
rather than comprehensive sexuality
yes,
education,
yes.
so to avoid controversy.
Yes.
Is PopCom part of that retool?
Yes, yes, Mr. Chair. We are part of the work that DepEd is doing, providing inputs to the reproductive health education curriculum.
And then, on a separate topic, I saw in a COA report that there are IUDs and POP that expired. Total cost is about 250,000. POP about 442,000. So, PopCom is also buying this type of commodities.
Not anymore, Mr. Chair. So it's now the Department of Health.
Okay, all right.
Our support to Department of Health as regards this is monitoring and tracking the supplies of contraceptive commodities. So we actually provide information to DOH about this expired family planning commodities. And in some regions, we help them with supply chain management. So they purchase the commodities. They are in the warehouses of DOH. But as to addressing the requests of the LGUs to augment their supplies, we provide such service. So we coordinate with the CHDs in the region.
PopCom doesn't buy commodities anymore. It's really
Not anymore.
DOH. Okay.
DOH.
All right. Yeah. Yeah. Can I'll go to PIDS and I see Secretary made an appeal on their office. Can you give us, Mr. Chair, can you give us some briefing on the PIDS building?
Yes, this is a project that we started actually in 2014. But again, it was only revived in the past in 2020, when we signed an agreement with UP regarding this. So for the structure that we have now, we've already signed a use of rock agreement with the University of the Philippines last June 2024. And there's already a schematic design for the building that was already developed, and there's already some cost estimates already for the construction of the building, which we hope to start next year. According to that estimate, the building will cost around 811 million. And in the first year, 2026, the request was to have initial amount of 300 million pesos for that. We requested that amount from DBM, but we were only given 50 million for next year. So that's why, Mr. Chair, the additional request for an extra 250 million for that.
Right now, you're leasing an office.
Yes,
No,
Mr.
in
Chair.
Centris, in Centris, no, in
Yeah.
Centris.
Yes,
Okay.
for the lease amount costs around 40 million pesos a year.
Okay. And then the proposed office will be, where's the proposed office?
In UP, Mr. Chair, near the National College of Public Administration Governance. It's 11,250 square meter building, 9-story building. 6 6 floors will be occupied by the PIDS.